We are getting the latest on COVID-19, and joining me now is Dr. Malathi Srinivasan from Stanford Health Care. Thank you for being here.
Oh, Carly, it's great to see you. Thank you for having me again.
Let's start with my first question. How often could we see waves of COVID infections?
So COVID-19 is behaving much more like the common cold, meaning the common cold coronavirus, than the seasonal influenza, which just mainly comes in fall. So rather than seeing a season of coronavirus, like we have influenza in the fall and early winter, we're probably going to see a continuous circulation of this virus. And most likely, people are going to get infected with COVID 2 to 3 times a year if they're not careful. And the challenge in this is going to be threefold. The first is that a continuously circulating and mutating virus makes the timing of figuring out when you're going to get vaccines very difficult. And the second is, without really months of lead time, vaccine manufacturers are going to need to continuously sample viral strains and then race to keep up with more virulent strains, and then just really develop much more faster distribution channels. And finally, people are going to need to be continuously careful when they're in group settings or indoors. And so the problem's not really getting, say, mild Omicron variant, which doesn't make you really that sick if you're fairly healthy, but rather in developing long COVID, which seems to be happening with a good percentage of people. So I don't think we're going to see waves. I think we're going to see a continuous endemic of COVID.
And now that the FDA has authorized Pfizer's boosters for children as young as 5, do you recommend parents get their children boosted as soon as possible?
Yeah, so last week's decision to authorize Pfizer's COVID-19 vaccine booster for children 5 to 19 who've already gotten 2 shots comes exactly at the right time as cases of COVID around the country are rising. Now, in general, kids get a lot less sick than adults when they get Omicron. And the 2-shot series provides some protection, but we've been really disappointed. It hasn't provided as much protection as it does for adults. So we think that this 3rd booster is going to make a big difference, and it'll shore up the defense of kids. And the reason to get the vaccine for kids is twofold. First is that we don't know the long-term effects of COVID infection in kids. And second, some kids are already getting long COVID-like symptoms, including cognitive performance issues. So there's a couple things to consider, right? So the first is that the timing of the vaccine needs to be very personalized. Most kids in the country have had COVID. And if the child has received their first series and then gets COVID, parents should probably wait 3 to 4 months before getting a booster. Okay? And second, what we hope is that we'll be seeing new vaccines updated for the new strains by fall, but the timing isn't really clear. And third is that the public health impact of the vaccinations might not be as large in kids as we hope, because of the 25 million or so kids who are 5 to 11 years old, only a third of them have had 2 shots. So the benefit's going to be individual for the children and for their families, especially people whose families have people who are immunocompromised. But it's not going to get us to the herd immunity that we need to have overall transmission rates drop. So it'll be protective for the kids, but not for the community at the current vaccination levels.
Got it. And for those 50 and older who haven't received their 2nd booster yet, do you recommend they do so now, especially as cases rise, or should they wait until the fall when new vaccines could provide better protection against the virus?
So for people with healthy immune systems, immunity after vaccination seems to wane at about 4 to 5 months, but it's still protective against hospitalization and deaths from all strains of COVID. So since it's now May, I get vaccinated with a 2nd booster and then get revaccinated in fall when the updated COVID vaccines come out, because that'll be about, again, 4 to 5 months. So I think that this vaccine is going to be a 1 to 2 times a year vaccination, especially as more virulent strains appear. The current Omicron for most people is pretty mild. So if you've had COVID-19 recently, I'd wait 3 to 4 months. And the reason healthy people in their 50s are undecided is because the current strain isn't as deadly as Delta, but it can still lead to long COVID. So, but if you are at any age and you have a weakened immune system, it's imperative that you get your 4th shot and stay up to date on all of your vaccines, not just COVID.
And you mentioned long COVID a little bit, but what do we know so far about Omicron and the risk of long COVID?
Yeah, there are millions of Americans suffering with long COVID symptoms, and we think it's probably between 10 to 30% of unvaccinated people and people who've had severe illness Now, the UK just released our first batch of really solid data showing that among triple vaccinated adults, about 1 in 15 who have Omicron BA and 1 in 12 people who've had Omicron BA2 will end up having long COVID symptoms. And this is 4 weeks after their initial infection. So they were fatigued for a while, most people got better, but a good number of people are actually having persistent symptoms. And in the UK, that's 3% of the population. And this is particularly reliable data because England's Office of National Statistics has been testing, get this, about 150,000 people per month, sampled from around the country. So it's pretty good sampling and it's pretty solid data. And you can get long COVID even if you weren't very sick. In fact, about 3/4 of all the people who get long COVID haven't been hospitalized, and 1/3 of them were healthy, meaning that they didn't have any pre-existing health conditions. So the symptoms are lasting at least 4 to 5 months on average. And these are breathing problems, cough, fatigue, high blood pressure, cognitive difficulties, performance difficulties, brain fog. And this is based on a study by Fair Health using, get this, just private insurance claims data. So if you think about the people who are more medically vulnerable, people who are on Medicare or who are getting Medicaid, those numbers are going to be much higher. So this is a very serious issue, not just in terms of initial infection, but in terms of the consequences of those infections.
And finally, what makes you more likely to get long COVID and what does it do to your body?
So there are 4 things that raise the likelihood of getting long COVID once you've gotten infected. The first is if you had really high viral levels, and most of these people get pretty sick. The second is having certain autoantibodies that can get revved up or can develop in response to COVID. And the third is reactivation of the monovirus, Epstein-Barr virus, which is pretty common and people have had it quite a bit. And the last is having diabetes. And we're learning a lot more over these past months about what long COVID does to the body. And this is important because it's been so frustrating for patients when they look fine on the outside and they're telling people, I just can't do what I did before. And what we're finding with more advanced performance testing is that the brain is having inflammation and there's lower oxygen levels, that the lungs have evidence of oxygen limitations and potentially thickening of some of the membranes between where the air comes in and where it gets absorbed into the body. There might be some early scarring, micro blood clots causing vascular damage that can trigger fatigue. The immune system, autoantibodies attacking the body, and viral remnants, which might be revving up the immune system and also leading to the reactivation of Epstein-Barr virus, again, which causes mono. So the take home for this is that even though masks are optional now in most parts of the country, it's really important to try to avoid getting ill and really keep your vaccinations up to date, not just for COVID, but for all of the vaccinations. And please continue to wear masks when you're indoors or in any high risk setting. So we know this is a very real thing. Millions of people have been experiencing it. They've been very frustrated. And hopefully, as we learn more, we'll also start developing some therapies that can help.
Well, thank you so much for all that great information and for joining me today, Dr. Malathi Srinivasan from Stanford Health Care.
Great. Thank you so much. It's great to see you.